Hospital surgical teams work together to optimize patient care, including preventing and managing infections. But routine and familiar practices such as ward rounds make it difficult for team members to be aware of and evaluate their behaviors and the effect on team dynamics. To bring these familiar practices in plain sight, we present a new view of such interactions as a shorthand for recording interactions. We applied hand-drawn directed sociograms whilst observing clinical care to capture how a surgical team makes decisions about antibiotics and infection management on ward rounds. Sociograms are visual representations of links or relationships between people. Individuals are represented using symbols, and the relationships are shown using connecting lines. Recording communication in real time, we identified communication themes relevant to infection management, such as antibiotic use, cultures and sensitivities, and key infection markers. Assigned symbols and colored arrows indicated who was talking to whom and about what. This sociogram from a patient handover helps to visualize and question. Who is there? Where do they stand? Do they have a role in infection management? Who talks? What are they talking about? Who are they talking to? Who makes patient plans? Who are these plans directed at? And most importantly, the implications on infection management. This shorthand visualization enabled communication and dynamics to be captured across surgical teams in a tertiary hospital, especially in relation to infection management and antibiotic use. What have sociograms highlighted about communication on infection care from morning rounds in one setting? Though many healthcare workers attend ward rounds, communication remains between registrars and consultants, with nurses not actively engaged despite having important infection management roles. Where staff position themselves on rounds seems to predict their participation, with most discussions occurring between those centrally positioned. Nurses, who generally stand on the outside, can miss out on key information related to patient care, such as de-escalating antibiotic therapy or removal of a peripheral intravenous catheter, stopping antibiotics or starting new ones. Also, infection discussions vary between personnel across different teams with different specialties, which means inconsistencies can appear with infection management practices, and especially around antibiotic de-escalation or removal of urinary or intravenous catheters. Leadership style also determines who is engaged in discussions and how key decisions are communicated, both between staff and to the patient. Inclusive engagement with both patient and staff is also influenced by the consultant leadership style. Only some consultants consistently communicate the plan, which includes antibiotic treatment and infection management with the patient. Sociograms provide a powerful visual illustration, giving participants a global view of their own and team interactions, dynamics, and communication, providing insight into how the existing gaps in communication can be addressed.